relationships with specialists can be kind of tricky sometimes. Now, if you get yourself into this situation, what do you do? We're going to talk about it today. Hello there. I am Dr. David Madow, along with...
I'm Dr. Richard Madow. We are your co-hosts on the Dental Practice Fixers podcast. And yeah, we do have a really interesting question today about the relationship between GPs and specialists that I think everybody's going to love and learn from. But hey, real quickly, some of you, which is really cool, only really know us from our podcast and have asked how else they can get more information from us. So we send out an e-letter 2, 3, 4 times a week, depending on what's going on. We'd love to have you as a subscriber. There's always great stuff on there, and you can hear about some of the other things we're doing to enhance your practice. So just go to Madow.com, Madow.com. Scroll all the way down. Just keep scrolling, or look at some other stuff on the site if you like, but keep scrolling. There'll be a little clicker thing there so you can subscribe to our newsletter. We won't sell your email address or hand it over to anyone else. No spamming or any abuse like that. Just good information several times a week.
Yeah. Do it now.
While you're thinking of it, always good advice.
And I'll tell you something, guys and gals, it's not as much scrolling as Rich made it sound. You scroll down a tiny bit on the page, a tiny bit, and you're there. It's very, very easy. So let's see you on our list. We'd love to have you on that.
All right.
This is a good question I know you got today.
Let's get to it. Okay, it says, Dear Fixers. I always comment on the way we're addressed in these emails. I like fixers, dear fixers. That's a good one. We get dear brothers, dear doctors, dear Dave and Rich, dear Rich and Dave, dear. One time somebody wrote asshole and his brother, which was really confusing. I wasn't sure who was who there, but whatever. Okay.
We are the fixers, though. We are definitely the fixes.
Dear fixers, I opened my practice about 8 years ago and things are going well, but I do have a minor dilemma. There is a specialist very close to me, parentheses, I prefer not to say what specialty. When I first opened my practice, he welcomed me, took me out, was very kind, etc. Of course, he wanted my referrals, but seemed very sincere too. In the ensuing years, we have had a great relationship. I refer to him, he refers to me now and then, we have socialized, etc. He's a good guy. My patients like him. So here's the problem. As I become a more experienced dentist, I'm seeing that his work is not what I would call fantastic. It's certainly acceptable, but there are other specialists who are much better. How can I keep referring to him? Again, the relationship is great and my patients love him. If I needed the procedure, let's highlight that. When if I needed the procedure, I would go elsewhere. A colleague advised me to give a patient 3 choices and that would solve everything. What do you think? Flustered in Florida. Love the alliteration there. Flustered in Florida. This is a fantastic question and an uncomfortable situation, don't you think?
I was going to say the same thing. It's a great question. Tough situation. I'll say right off the bat, though, Rich, I don't know about you. I don't love the idea. We can get to the beginning of it in a second, but I don't love the idea of giving 3 choices. You hand somebody a card and say, "We'll call any of these 3." I think when you refer to a specialist, in my opinion, I think you should say, here's who, you need this procedure, you need a specialist, here's who we recommend, instead of like a grab bag.
I'm going to second that emotion. I remember, it's funny. I remember when I first started practicing, some wise old sage dentist gave me that advice and said, Rich, let me tell you a little trick. When you refer to a specialist, give 3 choices. And I said, well, why? Wouldn't you want to refer to the best or to the one that's best for that person's situation? They said, well, it's a legal thing. If you give 3 choices and then they go to one and that person screws up and they get sued, you're going to be off the hook because you can say, well, look, I gave you 3 choices. And they said, that's bullshit.
Total bullshit. That is the most
aggressive lawyer. If they find that they need to sue the referring GP, which is ridiculous anyway, but if they do, of course you're going to get sued. That doesn't get you off the hook. That was the stupidest argument I've ever heard for doing it. I think it's confusing. I want to know who's the best. I've been referred by my internist, for example, to recently he thought I had a polyp in my sinus, so he sent me to an ENT. And he said, I want you to go to this guy. He's the best. I thought, well, that's the guy I want to go to. Not here 3, pick. Well, how do I know? I want your advice. You're my trusted internist. I want your advice. And I was very happy with that selection. And it turned out I didn't have a polyp in my sinus. So
good going.
But
Good, good.
but I totally want to be referred to the one person and look, maybe there's a periodontist who's really great at implants, and maybe there's one who's really great at periosurgery, and you want to tailor your referrals that way. So what the heck, do it. But that just speaks to a small part of this question.
Yeah, right. Exactly. We're both in agreement there. But so let's get back to the very beginning of the question now. I mean, you've referred to this specialist. You become really good friends. You've got a great relationship, but now you're noticing that, Now here's the question though, and we don't know the answer to this one, but I think he said in the question, his work is okay, it's acceptable, but maybe not unbelievable. How did he phrase that again?
Yeah,
It's okay.
he said his work is not what I would call fantastic. It's certainly acceptable, but there
Acceptable.
are other specialists who are much better. And then I thought maybe the kicker there was he said if he needed a procedure, he wouldn't himself go to this specialist. Or she.
Yeah.
I'm not sure if flustered in Florida is a he or she, but yeah. So how could you, let's just say, I don't know, he very wisely kept the specialty out of it, but let's just say it's an endodontist. How could you refer someone to an endodontist, to endodontist Dr. B, when you know personally you would go to Dr. A?
Couldn't do it.
I couldn't either.
It's a very tough situation because they become very good friends, but it's not the
and
right
the specialist
thing.
refers back. Specialist refers back to him or her.
Yeah, it's a very, very tough situation. But like in my heart of hearts, I know that I would want to refer my patients to the best and to the one that I would want to go to. I mean, that would be the most ludicrous thing ever if I was referring to a certain specialist, but I needed a procedure and I went to somebody else. That would be crazy.
Yeah, I remember, again, back to when I first opened my practice, I remember immediately I was wooed by everyone, an oral surgeon, a periodontist, an orthodontist. Those three in particular came right out of the woodwork. The periodontist was fantastic. I referred to him throughout my entire practice and career. The orthodontist and the oral surgeon were both great guys. They schmoozed me in a good way. I'm not saying it's a bad thing. I knew that my patients liked them. They had great personalities, but I did actually prefer a different specialist when it came to that, a different oral surgeon, a different orthodontist, and I referred accordingly. And I don't know, I probably did lose some back referrals due to it, maybe even lost a couple friends, but I couldn't keep on it.
I think you did the right thing. I would have done the same thing in that situation. So I think answering this doctor's question who wrote into us, I mean, I think our answer has to be you need to refer to the doctor that you think is going to be giving the best care to your patient. I mean, is there any other way around that?
Well, I know some people would say, like, look, there are, again, we use endodontists. There are 3 endodontists within 5 miles of my practice. They're all good. I like to spread it around. I just think it's the best thing for everyone.
Yeah, okay, but again, this dentist wrote in for a particular reason. He's saying and also inferring that the one he's referring to, the one he's become friendly with, is, let's face it. I'm reading between the lines. I'm saying he's not that great.
I agree. I think, and I was going to point that out too. When you're talking about a specialist and you say that his work is acceptable but not fantastic, well, geez, if I send someone to an endodontist, I want that to be a root canal that would go in a textbook every single time.
That's exactly right. That's my point. So I think we both answered the question. I think you have to maybe make a sacrifice, knowing that your friendship may suffer and you might not get as many referrals, but you're doing the best thing for your patients. I mean, again, is there any other answer?
It's funny, Dave. You know about the specialist in my area when I was practicing. There was an endodontist, one of the guys that came out of the woodwork and wooed me right away. Right. He poured it on, and excuse me, he poured it on. I referred to him. It turned out he was practically a criminal. His work wasn't bad, that's for sure, but he would do extra root canals on patients. He would tell them all kinds of crazy things. Well, and then he'd call you. It was always the same thing. You get a call, Rich, this is Dr. Beep. I've got your patient Gladys. She's in the chair. She's numb. She's comfortable. He always talked like in that real reassuring, like FM jazz DJ voice. She's numb. She's comfortable. And I'm about to do endo in number 30. But I notice when I look at number 31, it's got a graze line in it. It's possible it's got some sensitivity to heat, cold. My feeling is it's going to need a root canal eventually. You're the quarterback now. It's up to you. But do you just want me to do the endo on that one as long as she's in the chair? Right? You remember the story, right?
Totally. Because guess what? I got that call too several times when I was referring.
You referred to him? I didn't realize that. He was a little far from your office.
When I was in Glen Burnie.
Ah, right. Oh, now we're giving it all away.
I remember, you know, it's okay. I remember in the old days when there was like a phone in the hallway. I'd be outside the treatment room in the hallway on the phone with this guy, and he'd be giving me that same spiel, the same pitch, same exact.
That's exactly where I was. The hallway phone. It was like an episode of My Three Sons. The phone was in the hallway.
Right.
Now, if I think he eventually lost his license. Did you hear that?
I don't remember. Didn't he like go to another state? Maybe
you think he got run out of Maryland?
I think I heard,
went to Florida.
I heard he went to Florida
with Renee Ganam.
I mean, when you get run out of Maryland and you lose your dental license, what does every dentist do? They run down to Florida, right?
I think a lot of people that get in legal trouble in other states run down to Florida. I don't know about the West Coasters, but here on the East Coast, it seems to be that way. You kind of like start a new life in Florida.
I think on the West Coast, they go down to Phoenix or something.
I thought maybe Vegas.
Or maybe Vegas too. It could be.
Cool. Okay. Well, I think we answered this question. I think we both say that social cues aside, and even back referrals aside, you've got to refer to the person you think is the best. Don't do I'm going to give you 3 choices. Now, giving choices when someone calls to make an appointment as a new patient, that's one thing.
Totally
but
different.
Giving choices when you're referring is kind of bullshit. Refer to the specialist that you would go to yourself. How can you go wrong doing that?
Guess what? We're in agreement. We're in 100% agreement.
Well, that happens every now and then. All right. Hey, I think
the last time we really did not really agree on something, like we were really kind of diametrically opposed, was the time we did the episode on CBD oil, and you thought it's something that's just going to go away, and I said no, I think it's going to get bigger and bigger. So time will only tell who gets that one.
Right. So okay, we're gonna have to bring that back up 5 years from now. Okay, so we've got a really interesting call of the week. Before we do, I just want to mention real quickly Care Credit. And here's the thing I want to say about Care Credit. We know that you probably are utilizing Care Credit in your practice. You might not be utilizing it correctly. We'll get to that maybe in another episode. But one thing you might not know is that Care Credit does so much more than patient financing. As a matter of fact, look, let's face it, it's in Care Credit's best interest to have your practice do well, because when your practice does well, you get higher treatment plan acceptance, your patients utilize Care Credit more. And they know that. So they've got all kinds of other services. Talk to your Care Credit rep. You can arrange a lunch and learn. He or she can come in and teach your team a number of topics. They can also do an analysis of your entire geographic area and tell you some things about some other practices in your area. They won't name them by name, but maybe some different Care Credit utilization strategies that they're using successfully, and show you why, and even how much they're doing per month. So the point is, your Care Credit rep is really there to help you. It's in their best interest if your practice does better, and it's certainly your best interest if your practice does better. So ask your rep or go to carecredit.com. Find out that they can do more for your practice than just financing.
Good stuff, Rich. And before we get to the call, which I know we've got a great call today, I know that for sure. I just want to remind our listeners and viewers that one of the most important things you can do in your dental practice is to have a lab that you're proud of. And when you do a crown or some type of restoration on a patient and you place it, it's easy placement. It goes in easily, and the patient looks in the mirror and everything looks beautiful, and you get compliments and patients are happy. Do you have a lab like that now? I'm wondering if you really do, because a lot of dentists are changing labs and they're not really exactly like 100% happy with the lab they're using. It's been going on since labs and dentistry have been in existence. And that's why we want to share something with you. We love, and we've talked to you about this before, we love Maverick Dental Lab. And the reason we love Maverick Dental Lab is because they're that type of lab. It's a small enough lab that when you use them, you know the owners, your cases get the attention they deserve, and the work is beautiful. And to prove that to you, Maverick is offering, along with the Madow Center, we're offering 3 free crowns. That's right. Your first 3 units with Maverick, just to try them out and see if they're for you, they're willing to do for free. Why would you ever turn that down? And there's no other lab, Rich, as far as we know, that is willing to make that offer, because Maverick is really, really, what's the word I'm looking for? They are
Confident.
confident. That's the word I'm looking for. Confident.
Tough word.
It's a very tough word. Sometimes my brain goes bad. But they're very confident with the work they're going to be sending you, and that's why they're willing to say, hey, look, we'll do the first 3 units totally free. The risk is on us, not on you. And if you like us, you can continue using us. We've never seen anything like this. So our offer to you is give them a shot. Why wouldn't you do that? Go to, it's very simple, 3freecrowns.com. It's all written out. The word's not no number, but 3 free crowns spelled out, and let them do 3 free crowns for you. And we promise you will love them. And if you like them, just keep using them. That's our offer to you for you today, 3freecrowns.com.
All right, let's get to the call of the week. You ready?
I'm ready, Rich.
Okay.
This is Kylie. How may I help you?
Hi, I've got a question for you. It might sound a little weird, but does your dentist wear gloves
Yes.
all the time?
Yes, when working with patients, yes.
I went to a dentist a few weeks ago, and for one part of it, he wasn't wearing gloves, and I thought it was really weird. And they said, well, as long as there's not bleeding or anything, it's not, I thought it was like the law.
Well, I'm not sure about the law, but I know it is I'm sure it is some sort of under the government. You had to wear gloves when you're working with patients. Was he working with in your mouth and everything?
Yeah, he touched my tooth.
Oh.
Yeah, it was weird. And how about the hygienist?
Yeah.
Does the hygienist wear gloves?
Yes, always. Yep.
I'm glad to know. Okay, that sounds great. I think you might be much better than that other office. Thank you so much. All right.
You're welcome.
All right, thank you.
Bye.
Bye.
Yep. Bye.
Bye.
Oh, wow. The calls just keep on coming.
They keep on coming. Just when you think you've heard it all.
That was a great question. And look, she did say, yes, our doctor and hygienist wears, they wear gloves for all procedures. That was fine.
It was fine.
It was fine.
She kind of hemmed and hawed about well, I don't know if it's some kind of law or regulation. Besides the end of the call, which I'm sure we'll get to in a second, which obviously she didn't do well. I think she should have taken this opportunity to say that, of course, our doctors and hygienists wear gloves, and we follow the strictest sterilization codes. Just gone a little bit more about how the office is super clean. They really take pride in the fact that they've got a hospital grade autoclave, or not even autoclave. You don't even use that word, but hospital grade
sterilization system.
Exactly. Just reassure the patient or the potential patient that they are totally not only up to code, but go above and beyond to make sure that the office cleanliness is just fantastic. That would have really resonated with somebody who just came from an office where the dentist wasn't wearing gloves.
My question is, Rich, are they teaching this stuff anywhere? Because 99.9% of the calls we make are basically, I'm going to use the word flub. They're just bad. The person answering the phone is not doing the best to her ability to give the information and also to get the contact information and get the caller scheduled. We just don't see it happening. Maybe
I so agree.
Rarely.
Well, a couple things. You've got to calibrate, which I know you've talked about before on podcasts, and you've got to do role-playing phone calls at team meetings over and over and over again. Have everybody critique. Be tough as nails when you do critiques. I mean, I know we're all team, we're all friends, but be tough and do it to one another until everybody's phone skills and ability to think on their feet are just top-notch.
Yeah, I mean, this is a problem in dentistry. It's pervasive. I mean, it seems like every dental office, no matter what the doc thinks of the person answering the phone, seems like every dental office has this problem. And Rich, I think it's going to be up to me and you to solve it, because nobody else. I know they've got these academies and these great, but nobody is solving this problem yet. It's out there.
I'll tell you what's unbelievable about that. In our many, many years as coaches, we've worked with some great offices, and so many offices that we work with come from a bad experience with another coach or consultant. Some of them say, oh, I tried 4 consultants. And then you think, well, did they teach this? Did they teach you the most basic phone techniques? Were you actually paying attention? I hope they taught it, because I mean, that's, in my opinion, malpractice from a coach or consultant.
Yeah.
You work with a practice and this is how they're answering the phone. But if they did teach it, did you listen? Did you pay attention? Did you work on it? Or did they maybe not teach it? You can be sure that every office we work with, by the time we're a few months into relationships, they have great phone skills. No question about it.
I'm going to go out on a limb and say, like, I know there's a company that's all, this is all they do basically, is they teach phone technique. But let me tell you something. If that's the case, we certainly have not called an office that they've dealt with. I'm not so sure they're doing a good job. I hate to say, because we're not seeing proficiency out there, and this is one of the most important things in dentistry.
Possibly the most important thing. Yeah. Everybody wants, referrals from patients and high treatment plan acceptance. If you can't get them in the office, you're not going to get anything. So it all begins with that. And I think we know how we're going to conclude this one. It was a good question. Her answer was fair at best. I would say her answer was acceptable. She reassured the patient that this dentist and the hygienist wear gloves. Then boom, what happened? No asking for the appointment. Come on.
F. Sorry. F.
Triple F? You're giving the triple F?
Yeah, I'm sorry. It's like I want to give somebody an A or a B, but we're trying so hard, but it's just not happening.
Yeah, I'm going to give an F as well. And I feel like I say this all the time, but podcast listeners, we do not do 10 calls and just play one because we think it's the best teaching opportunity. We do one call per podcast, and that's it. What can I say?
I mean, we want to do a call where they actually do really well to prove that somebody out there is doing the job right, but we rarely find that call. Rarely. Agree.
So that said, it's out there somewhere. We're going to find it. And thanks so much for listening to the Dental Practice Fixers podcast. Tell your friends, tell your colleagues, tell everyone you know about the Dental Practice Fixers. I'm Dr. Richard Madow.
Dr. David Madow here, and we will see you next time. Thanks so much.